So now let's look at benzodiazepines. These are the keys. They've been around, but what happened in the beginning? We got one that's about 5 times more powerful than Valium. A lot of people died because they were giving it as if it was Valium. They gave the same dosages without thinking. And that's what people do with stuff. So you have to be careful. There was a time half of our medications looked just alike. They had the same colors, same size. I've given the wrong medication in my life, I'll just tell you. One day I thought I was giving a reversal, but I gave the drug I was trying to reverse. But I'm lucky. They just came in and said, can you hold this patient in here a while because we're backed up in the PACU? I said, not a problem. I got to wait till this paralytic wears off anyway. All right. Okay, agents that are used, benzodiazepine, they are the most widely used. Probably work in the limbic system. And we're going to talk about the limbic system and the amygdala a little bit more. But I'm going to tell you what they are. The limbic system is a part of the brain that tries to maintain a baseline. It has to do with where our memories are stored. It also has a part of that limbic system is the pituitary gland, which coordinates with the adrenal gland in this fight or flight. So, but the one that's the activating system is the one that filters the information from outside our body to inside our body, and that's called this one here, the amygdala. The amygdala tries to create fear. It's a protective mechanism. So it's always going to see things basically according to our past perceptions. Life is a perception. There is no reality, and it's based on what? On things we've experienced in the past. That's why it is so important to understand what the past history of these patients are in coming in for surgery. I walk into a room one day, and there's a patient climbing out of her bed in the holding area. So I'm walking in the holding area, and I know it's my patient because it's the only one in there. But there's nobody else in there. So I say, Mary, where are you going? She said, I'm getting out of here. I says, well, that's fine. I says, how about you get back in bed, let me put down the side rail so you don't hurt yourself getting out. Now, what did I just do? Gave her control. If I'd have said, now, Mary, get back in that bed, you can't leave, then I've got an argument because she's going to show me that she's in control. Get back in that bed. So we went through some processes, but here's what happened. 3 years earlier, she'd been in surgery in the holding area. And she waited, and nobody come talk to her. See, remember what I said? There's nobody in there. They left her by herself. Deja vu, PTSD, and all of a sudden, about 2 to 3 hours later, could have been 20 minutes, but in her mind, it was 3 hours. Somebody walked in. Well, I don't know if we're going to be able to get to you today. We just had a death in the back. I don't know if I want you to get to me today. But people do that. And you've probably heard it from some of your cohorts. Hopefully none of you said anything like that. But when I was in regular practice in the hospital, I would hear that from people every day. Now when I go in with my family, I hear that same stuff from the most trusted profession out there. Well, that was evident, and I don't know who that was. All right, so this is what we're working on. The limbic system is where they think they work. Now here's the other thing about the limbic system. When you think, when you listen, it responds. That's why when you can think about a lemon, you can feel it right here. That's why when you think about somebody that makes you so angry, you get angry again. So keep in mind, if these patients start thinking, they're going to respond as they've responded in the past. How many of you are married or been married? You know exactly what I'm talking about already. All right. Benzodiazepines. They are anxiolytic. What does that mean? Good, you read that. That's what you should have been doing. But the point of it is this. It just takes away the anxiety to a degree. And once you can take away some of the anxiety, what is it that we have stopped the activation of? Adrenaline, norepinephrine, cortisol, all of those that come from where? The adrenal gland. But how does the adrenal gland know to activate those drugs? Because that's what they are. They're just drugs. How does it know to activate those drugs? The limbic system, exactly. The amygdala says, you should be afraid here because in the past when you came here, you hurt. You had pain. When it was over with, you had pain. So if you're thinking that then they are in fight or flight. I want to get the heck out of here. I don't want to stay here. All right, so those are the things that happen. Now, amnestic, though, is good. Benzodiazepines, there's two types now as far as amnesia goes. One that is retrograde, one that is anterograde. What's the difference in the two? What's retrograde? Backwards. So it may have happened, a minute ago, but you won't remember it. However, benzodiazepine midazolam is not retrograde. So therefore, when your doctor says, give them some more Versed so they don't remember this, ain't going to happen. They've already got it. It'll be a memory. Anticonvulsive. Now that's a good thing. Keep that in mind because there's something can happen if you try to reverse it. And then, of course, this is cool. It is actually a skeletal muscle relaxation. How many people do you know from years ago that they were on Valium because of skeletal muscle? Well, if you're in fight or flight, guess what gets tense, ready to run? Your skeletal muscles. They tense up. A muscle to move has to have tension. So therefore, if you're in fight or flight, it's ready to do what? Fight or run. It's ready to move, so it's getting tense to go. All right. The effects of benzodiazepines, sedative, hypnotic in large doses. What do we mean by hypnotic? Because all of our anesthesia drugs are characterized as hypnotics. What does that mean? Okay, let's take a very simple form of the definition of hypnotic or hypnosis. You're more open to suggestions. In other words, you let go of that. If our brain was a true computer, it would be that firewall that doesn't let stuff in, all right? So now you're just less inhibited, like having a couple glasses of wine. So now what you've done is you've got this hypnotic effect. So when you talk to your patients, they're going to respond in a whole different way than they would if you had not given those benzodiazepines. So what you say now becomes extremely effective, and it can make a huge difference in the amount of drugs you have to give. So if we move back now to your restless leg syndrome, you just give them some little Versed, and you say, I've just given you some Versed now, and we found that this usually allows your legs and your body to relax. Is that a lie?
It's not.
No. So what is their perception? Their legs going to relax. That's how it works. It's that simple. Try that and see what happens. You may be amazed at how just calm and relaxed you are as you lay there. You don't say your leg, because if you say leg, what did you just do? Brought the attention. Brought the attention to it. And they'll go out there and they'll brag to their friends, man, they told me I was the worst they ever had. They said I danced all over that table. Now they're proud of that. People are proud of that. Hey, my doctor said I had the most stitches of anybody he's ever worked on. You never hear anybody say, my doctor said I was the best patient he ever had. They don't talk about that. Christy knows. She's been a patient. All right. So let's move then into, now isn't this amazing? Not a lot of respiratory depression when you use benzodiazepines by themselves. But you put a little narcotic with it, now you've got some stuff going on, all right? You don't want to use it when they're pregnant, if they're alcohol intoxicated, if they've got glaucoma or other CNS depressants if they're taking them. So you want to make sure you don't give them when those are out there.